Okay. Welcome everyone to another enlightening episode of Know Your Calling, a platform created with one clear purpose to help budding medical students discover the branch that truly resonates with them. In India, many medical students choose their future specialities based on trends, ranks, or vague information, often without really knowing what a day in the life of a specialist looks like. That's where Know Your Calling steps in. Initiated by Dr. Dheri Bogani sir, a passionate neurosurgery resident and researcher, this platform brings you direct conversations with real doctors from various branches, offering honest, practical insights into what they do, how they work, and what life looks like in that field. Today, we have the privilege of speaking with Dr. Dheeraj Maheshwari sir. Sir is serving as an assistant professor in Department of Forensic Medicine at Pacific Medical College and Hospital, Udaipur. His journey began at Dr. S.N. Medical College, Jodhpur, where he completed his MBBS after gaining hands-on experience as a junior resident in general surgery at MGH Bhilwara and a stint in the private sector. He pursued his MD in forensic medicine from Rajiv Gandhi Medical College, Thane, along with a postgraduate diploma in crime investigation and forensic medicine from MLNU, Mumbai. He further honed his skills with a senior residency at Cooper Hospital, Juhu, Mumbai, and his academic and research contributions span prestigious platforms like Forensicon and Medicon, including award winning presentations and paper sessions. Not just a medical mind, Sir is also a digital educator with a powerful online presence. Over 35,000 followers on Twitter, 30,000 plus combined followers across two Instagram pages, nearly 1,000 YouTube subscribers, and 1,500 plus connections on LinkedIn, making him a thought leader both offline and online. So let's get ready as we dive into the world of forensic medicine, its real life challenges, opportunities, and why it might just be your calling. um, Sir actually needed is well known to all of us. So without any further ado, I would like to start with the first basic question that what actually, sir, please explain briefly what forensic medicine encompasses beyond the textbook definition or as a general overview of the forensic medicine.
Uh, good. Hello, everyone. So, forensic medicine is not your regular branch. Like, you won't be treating any patient like in medicine, surgery, gynae, where you will be treating patients. Here, you will be treating different, doing different kind of work. Like, you will be seeing the dead bodies, you will be finding the cause of death, you will be doing the examination of the accused and the victim, age estimation in cases of kidnapping, murder, rape, like that. So it's a totally different branch, and where if you don't want to interact with any patients or you don't like the clinical side of the medicine, then you can definitely opt for this branch. So this is forensic medicine. Like here, you have the intersection between the law and the medicine.
Thank you, sir. Sir, I would also love to know about like what was your typical day during your MD at RGMC and what kind of it was, how demanding was it in terms of the physical and mental stress, and what was the clinical exposure and case mix that you got there?
As I was the first resident there, before me there were no residents. It was the first time the seats were included in the seats were allotted for the PG. So I was the first resident, and yes, I had so much exposure. Like I did around 1,000 to 100, 1,000 1,500 autopsy in 2 years because of the COVID. Uh, my juniors came late, and also I had to directly interact with the AP and the HOD directly, so there was no issue like that. We used to have lunch together. Work timing was from 10 to 5, no evening duties, no night duties, no emergencies, anything like that. So, and second Saturday and fourth Saturday off, Sunday off. So it was overall good, thing.
That's really nice to know. So, no, sir. Sir, how did you personally deal with handling dead bodies for the first time?
Like I was excited, like because to know the cause of death, how the autopsy is done. Because during my internship, I have never seen any autopsy. I have seen the autopsy only after joining residency. So I have never seen any autopsy, and it was like the I will do select the branch what I am getting, and let's hope कि जो होगा बाद में देखा जाएगा. I didn't think so much, overthink so much about the branch and everything. So it was just like that. I got the rank. I don't want to study any further, so just I took the branch.
Okay, sir. Sir, so what made you choose this specialty over there were so other options and Like, and what part of forensic medicine do you find most rewarding?
About from the other branches, like I had worked in surgery after MBBS, so it was so hectic, and I didn't want to go into the medicine, surgery, gynae, peds, anything like that, where you have to work, 24 hours or seeing the clinical and doing rounds and everything. I was not interested in treating patients. Like I did MBBS because I was intelligent, and my parents told me to become a doctor, so I gave NEET and I cleared it in the first attempt. So that's it. I didn't think about yeah, I want to become a doctor or nothing like that because there was not proper counseling. You have to do this. So because when a child enters into MBBS, then only he knows. Oh, इसके आगे भी और पढ़ाई, like we have to do other things. We have to select other branches like that. It's not like you after entering into MBBS you will be doctor. You have to give your whole everything. You have to be passionate. So that's not me. I'm like a lazy person and I want my sleep. I prefer my sleep over anything. So that is the thing for me.
Yes, very true, sir. Actually, it is the story of many students. Many students actually don't have that clear idea that what actually they have to be. It is just through the peer pressure or whatever looks glamorous to them. Just they go with the flow, kind of thing. So that's the case with many students, not just you, sir. Sir, next thing, like there are pros and cons to each department. So, what do you think? What where are the biggest emotional or systemic challenges in this branch, or do forensic experts also they face some kind of threats, legal pressure, or burnout, or does this
So
affect, yes, sir, affect your health and your career progression?
so most this thing is that other clinical people will look down on you if you take forensic medicine. Other clinical people will think that कि इसमें तो क्या ही है, ले आएंगे ऑटो ओपन डेड बॉडीज दैट्स इट एंड वो भी that is also done by a technician or the fourth grade. So it's just a like a branch where you are not dealing with patient, you are not treating patient. So like what happens is every other clinical branch they look down upon on non-clinical branches. So you might have to face this. And about the legal threats and everything, since you are a resident doctor, so you won't be dealing with high profile cases in most of the institute. You will have seniors there who will be dealing with them. And even if there are legal threats and anything, then you can make them understand if what you are doing, you have to do it like this because you have to appear in the court and everything. And even apart from that, you can tell them we will do that and this, and you can write your own in the language in the postmortem report because they won't understand what you are writing. So it depends on you how to handle everything. My HOD used to get threats, but he didn't succumb to any of the threats. But it is like the forensic medicine is infamous for this kind of things. Here the reports are manipulated, and they under being threatened, then you can change the report and anything like that. It is like that, so it depends from the person to person and institution to institution. Because it is not like that. The bad apples are only in forensic medicine. It is in every branch, every clinical branch. There are bad apples.
Very true, sir. Sir, so any challenges, specific challenges like you felt, or was it a smoothless journey for you? Like any challenges you feel like were there?
Yeah,
Or
sure. There are many challenges like when there is a VIP case or where there is a media sensitive case, then you have to do everything according to the books. Because if there is a minute change or when you did not preserve any proper viscera or sample or anything, then it can come back to you. And another in the cases of accused and the victim examination, you have to ask the proper history, take the proper samples and everything. So this is kind of different challenges here.
okay, sir. Sir, so when you chose, what if someone is choosing forensic medicine? So, what factors should he take into account, like the infrastructure or like the caseload? What are the factors that one should take into account while choosing forensic medicine?
So while choosing forensic medicine as a branch, first you have to ask about the institute, the department in that institute, whether the person there is toxic or not. Because what has happened is since there are very few faculties and they have been there since long, so most of them and they have so much power because they deal with police, criminals, and politicians on a regular basis. So they are on another level in many areas. And if you go to try, and if you go there and you try to change them or do something, then they become toxic. So first you have to inquire about these things, whether the institute is toxic, the person is toxic or not by the previously working people. Because I have seen many cases where the students have faced problems after joining the department because they don't know the person is toxic or not. It doesn't matter about the institute. And also, you should know about the case load and key what type of cases are there, any cases, how many postmortems are done, how many antemortem cases are done there. So all these things you should ask before joining the department wherever you are joining.
S- uh, Sir, like specifically, what differentiated you like from other specialities? Like what factors you look into that you were like attracted towards forensic medicine? Like there were other penicillin branches as well, many.
Yeah, the most important thing was I didn't want any clinical branches. So all clinical branches were out. And apart from non-clinical patho, I don't like because I cannot understand slides. Pharma, I don't like because I cannot, drugs and everything mechanism. That's like a rote mechanism. I don't like it. Forensic is to like something you can think, you can imagine. See how the scene was created, how the murder was done, when the firearm was shot. So you can imagine these things. And I'm more inclined towards physics, because my favorite subjects in during my school days, it was physics and maths, not biology, because I don't like to क्या बोलते हैं, रटना
Road
things.
learning,
I
sir.
don't like to rote learning. So I was more of a kind of imagination guy, and it is not possible in other fields of medicine, surgery, because you have to क्या बोलते हैं, rote learning in those things. You have to rote learning about the procedures and everything, and it was demanding. And I think about the forensic medicine because I am that kind of person who take path less chosen. So there were few people who were forensic medicine specialist, and I knew कि I don't have to suffer after MD for getting jobs in my city, like which I like, because I have been, after completing my MD, I have gotten many offers from various institutes across India. So I can go wherever I want, and I am not bound to anything. And it's not like I have to set up a practice. If I want to leave, I can leave and join another college. It is not like if I have to settle in this particular city. Like I want to be open for my future. Like if I do some business or something like that, then I am totally free to leave this behind and do that apart from things. Because I am not, I was just a doctor. I became a doctor because my parents want me to be. It was not my choice. So that's the thing.
Very true, sir. Actually, I was also influenced by my family members, actually, only, and it is the case of many students that they are influenced by their families and peers. Very few are there who are actually intrinsically motivated from inside to choose it. Sir, on a casual note, were you influenced by some crime investigation scenes or Dr. Saduki or something like that also?
No, no, no. I was just interested. I was not interested in this also, but I have to do the PG.
Yes,
That
sir.
is the main thing. So, kisme kare, and I don't want to study another year, or because at that time there was COVID. So, if I had not taken any PG during that time, then I would be 2 years late. And I just wanted to end this and start something new, or do something with my life, because it's been so long. I've been studying. Not, I cannot follow my passion or anything. I can. I just wanted to settle. That's it. That's why I did my PG. If I had gotten not forensic, then I would have done another like that. But I didn't want any other things because forensic was the branch. It intrigued me because many few people take it and nobody knows what actually forensic is. Even I didn't know before taking PG. After knowing, I am spreading awareness regarding this about other people. To other people.
That's really great, sir. And sir, I would also like to know, according to you, what mindset actually suits this field the best, and according to you, which type of people should not choose this speciality?
It these specialties for people who have other passion. Apart from they have done MBBS, that's great, but they are not inclined toward going to the hospital, taking rounds, and treating patients, working in clinic, seeing OPD. There are many doctors who don't want to do this, but so that kind of personality can take forensic medicine because the working hours are fixed, and after that they can do whatever they want to do. If they have any passion for singing, passion for dancing, passion for roaming and everything, they can do that. So first mindset is this, and second is it's a like not a high rewarding job. Like after completing your MD, you will earn around as an assistant professor mostly from around 1.5 to 2.5 lakhs or 3 lakhs in some remote institutes like in UP and everywhere. But there is no guarantee that they will pay you, because they are for NMC inspection only. They will recruit you for NMC inspection, and once that over, it is not guaranteed that they will pay you. So it is like that. So you cannot open your own clinic if you want to, earn more and work more. Then this is not for you. This is for the people who just want to a 6 hour job, 8 hour job, and then they have their own life like that. And also being interested, if they are interested in solving crimes and other part of the medicine, then they can join government institutes also.
Thank you, sir. Next question was this only regarding the career and financial. Like, how is the career trajectory in forensic medicine in terms of the time and money, like from residency to assistant professor? Also, is there any room for private practice or medical legal consultancy? And how do those salaries vary across the government, private, and academic sectors?
So the main issue is कि in government sector you will get the same pay as all the clinical and non-clinical people. Like after completing your residency will be same stipend for all. SR-ship will the same stipend will be same for all. And then assistant professor, the stipend will be same for all as other clinical and non-clinical branches. But in private colleges there is a huge disparity, because there are very few forensic people. So you can get in a good salary, like 2.5 times extra from the private government institute in a private institute, and you won't have to work any medical legal cases there also. So like if you want not to work in medical legal case and also on good salary, then you can join private institutes. Then you won't have to go to any courts, and you won't have to do any, if you're properly included in the teaching part, not in the practicing part of the forensic medicine, then this is best for you. Like I am also like only the teaching part of this forensic medicine, because in most institutes there is no proper area designated for the mortuary, and if they are designated, they are not properly maintained. So you have to build everything from the startup wherever you join. And apart from that, there the people are not educated about the forensic medicine procedure. So you have to convince them every time ki why the postmortem necessary, why we are preserving samples, and why we are doing this, and why is it taking so much time to get the report. Because once you send the report, then the FSL takes around 6 months. The histopathology takes around 1 year, and the court takes around 3 to 4 years for summons. So if you have done a case today, then you will get summons after 3 years, 2 years, 4 years. This is how the Indian judicial system works. So you have to consider all these factors, and then you can decide whether you want to join in the private or in the government. Because if you join in the government institute, you will get less salary, but you will have a proper, circle of police, politicians, and other people who do cases that you come. So you get some extra perks from that, because people will know you. So that's another thing. That's if you want the work satisfaction. But if you want the money, then you have to join the private institute.
Sir, can someone do like that? Do the government practice, and then there also he's doing some medical legal consultancy or some sort of private practice?
See, this medical legal consultancy is like in very infant, or I should say embryo or zygote phase in India.
Yes, sir.
It's because the Indian judicial system is very slow, and even the lawyers, they are not educated enough to ask questions, and the doctors who are doing postmortem, because most postmortem are done by MBBS doctors at PSC and CSC. In there are very few institutes where the forensic experts are present. So these doctors also don't know what to write, and the lawyers also don't know what to write, and the judges don't know what to see. So most of the time there is no scope for medical legal consultancy, because whatever the doctors write, the lawyers don't ask any question, and that's just finishes everything. Because I have seen many reports by the medical officers, and they are completely wrong, totally wrong. They have not mentioned anything, but still somehow it got accepted in the court, because there is no proper training to the lawyers, not proper training to the police officer, no proper training to the medical officers regarding the forensic aspects or the medical legal aspects, how to write a post-mortem report or how to write an injury certificate and how to write everything. And the court accepts it, and this is how the Indian judicial system works. So there is very little, medical legal consultancy scope of medical legal consultancy in India, and because most cases are in the clinical part, the negligence which happens, they happens in the clinical part, and there is the medical negligence, and they are done by the lawyers only, and they argue each other regarding this and that about the standard of care, and that's it. So forensic medicine is like very in the embryo or zygote phase in India currently, because there are no proper FSLs, there are very few FSLs, and they take around 6 months to 1 year to get a report. There are very few histopath labs. If you send the sample, there is so much workload, it takes so much time, and after that judiciary takes so much time. So the crux of the case, like if you have done a homicide case today, you will get summons after 3 to 4 years. So what is the use of doing medical legal consultancy?
Very true, sir. Sir, what are the options like if after PG, if someone wants to do some sort of super specialty or fellowship options, are it there in forensic medicine?
Yes, there are the from last to last year, the AIMS have started 3 DM courses. First is the DM forensic pathology, the second DM forensic radiology, and third is DM forensic toxicology. So if someone wants to again go into the clinical side, they can do DM forensic toxicology. So there you will treat the patients of the poisons and you will preserve the samples and do all the medical legal proceedings. And another is forensic pathology, where you will do the you don't have to send the samples to pathology. You can also do the pathology of those tissues, and that is that you will be a complete report. The report will be given earlier. And another is forensic radiology. It is for virtual autopsy, but the virtual autopsy centers are only two in India, two or three maximum. So these are also like in very zygote phase or baby phase. Even after doing all this, you have still have to join as assistant professor because there are no proper resources in other institutes. Once you do these things, but when you go for job, there are no proper institutes for this where you can use your specialization, super specialization there.
Very true, sir. Sir, you are there on digital platform also. I really want to know like how you're inspired, how you really came to such motivate people and guide people, and also your post I have, they are quite some alag level of confidence with you. Stark reality you like to write there. So how do you spare time for hobbies, your social life, and how do you balance it out all?
So it doesn't take much time to write a post on Instagram or X. It's like a few minutes of work. Like you should pick a issue that is sensitive and you should give your real honest opinions. That's what I think. And this is me. This is my personality. I don't lie. The I just speak from the heart and without any sugarcoating and without doing anything. I just post what comes to my mind. And other thing is that I don't degrade anyone or I don't belittle anyone because I don't pick fights on social media. I just post, I read the comments, and that's it. I don't pick fights. If someone is necessary, unnecessary disturbing me, then I just block the people. I don't pick fights on social media. So, and I want to genuinely help students. Like I get daily around 5 to 10 messages from the NEET UG students, NEET PG students, and other students, forensic science students, ki what we should do. Daily, I get so much messages and I reply to all of them. It is not like that I don't have time and anything. So, and after, that's why I choose. I want time for myself. I like to time for myself. It is not like that I want to be only included in this medical field only. कि like this घोड़ा चलता है जैसे सीधा उसके लगा दिया बस इसी रास्ते पे जाना not like that. I want to do anything what I can and I am doing that. So
So,
and I never really thought that I would get so much followers and anything. I was just doing it for myself, and I still do it for myself. I don't do it for followers. I still do it for myself. What I think, what I feel is right. I post it. What I feel is wrong. I post about it. That's it. That's my opinion I gave.
very true. Sir, what was that moment, or which was the year which really made you kick start or something like that, or that event which inspired you to like I should do something for other people as well, When was it started?
No, no, no. I never thought about other people. I only think about myself.
Okay.
I am doing this for myself. I
Okay.
want to post, so I'm posting it. If anyone is seeing, okay. If not, if no one is seeing, that's also okay. If I get 1,000 likes, I don't care. If I get 1 like, I don't care. I just do it for myself.
Sir, what was
Yeah,
that
I like to do.
time? It was during your residency only.
Yeah, during the second year residency, I started posting cases on social media, like the cases which I was doing about these things, because the people should know what does forensic medicine feels like, because at that time sudden deaths were happening, many cases were happening. So I was just like, if I know this, and many people who don't know what is forensic medicine, so I just started posting. I didn't care ki people are seeing or not, or what is like that. This is for just me. I want to take it out to the world, whether people like it or not, whether they want to like it or not, or follow me or not, I don't care. This is for me, and I am doing it for me. I am not doing for anybody, and I don't care about monetization. Nothing, nothing, nothing. It is just me. I like. My brain has so many ideas, and but I am also lazy to do it. So I work only on few ideas, because whenever I get a free time, then only I do it. Otherwise, I will just they are in my subconscious mind. That's it.
Very true, sir. Sir, we were talking about the practice. So, how do you feel it is different working in a tier one city like Mumbai versus Udaipur, or and also, would you recommend like working in corporate setups or government hospital for fresh MDs who are fresh MDs? Where would you recommend?
See, it all depends on you, where you are from, what are your goals, and if you are financially stable, then you can work in government hospitals. But if you are not financially stable, you are from the middle class with so many loans and everything, then you have to work in private institutes because they offer good pay. And also, I miss doing autopsies and everything, because when I used to work in government hospital, there were cases daily and everything. But due to some financial factors, I have to work in private institute, because government is not paying much, and there are also various issues in the government hospitals. No proper infrastructure, no proper the sources resources, no proper people who work under you. So that is the issue. You have to do everything, and apart from them getting a less salary, that's not my cup of tea, because money is more important for me, because I am coming from a middle class family background, and we have many loans, home loan, EMIs and everything. My father lost business, so I have to do in the private institutes. That's it. That's what I am doing. And it all depends on individual, what you want to do. If you want to work in government hospital, you can make a change. You can give proper reports, you can teach students, you can do everything. But if you want to earn money, you can go into the private setup. And depending on the city wise, yes, definitely the as you go to the big cities, there are big cases and the proper protocols are followed. But as you go to the PSC, CSC, and tier 3 cities, no proper protocols are followed, because no one is there to see. So everything happens according to go with the flow thing. That's it. So it all depends on you, whether you want to work, where are you from, in which city you want to settle, and everything like that.
Sir, in forensic, what are the trending like research areas in forensic medicine today, and how you do you feel that how has AI influenced your teaching or research or any your forensic medicine?
See, forensic medicine research area are very large, but the issue is there is no proper funding for that, because there are many cases where death occurs suddenly and we don't find anything on gross on histopath. But we can send those tissue for genetic, autopsy, molecular autopsy, but there are no proper institutes for that. We can do forensic virtual autopsy, but there are no proper funding for that. We can do institutes on forensic toxicology, ki kind of poison, type of poison, but there are FSLs are very few. So the main issue is ki research topics are so much here, but the funding and the resources, they are very few. You can do so many research on this, but only top institutes like AIMS, JIPMER, only they have proper funding for the research. Otherwise, in most of the institutes, there are no proper funding, no proper thing. Only those research thing are like that. Only the pattern of this and this injury, pattern of cause of death, pattern of poisoning. That's it. Only retrospective studies are done. So that's it. And also AI. AI can be very useful in doing this, in determining age estimation, determining many things, but cannot be used because of the proper funding and because even for living there are no proper funding in government hospitals. Then what will happen in private for dead people? Think about it. And most private institutes are not allowed to do any medical legal cases because the court, they only find only these kind of thing, only government doctors should do this. So in some institutes, in some places like Bangalore, Madhya Pradesh, and in South, some 2 3 states, even private institutes can do autopsy. But here in Rajasthan, no private institutes can do autopsy. Only government institutes can do autopsy or other medical legal work.
Very true, sir. Sir, in forensic, what are the like global opportunities, like, or someone wants to practice abroad, or are there additional certifications required, or what it is like that?
So see, this forensic medicine degree is not valid outside India anywhere. So you are no scope of going outside, because outside there is a different curriculum. It is forensic is not a subspecialty after MD. It is a subspecialty of pathology. It is called as forensic pathology. Like first you have to learn the pathology, and then you will be subspecialty of forensic pathology. So this degree is not it is only for Indian students. It has no scope globally because many people want to go, but there is no scope. No one recognizes this degree, forensic medicine,
Sir,
outside India.
any additional certifications they would require? Uh,
Certifications is not like you don't know the pathology. The
if they,
first thing is you should know pathology. Then you can do the forensic pathology. The main thing is that it is not called as forensic medicine. In other countries, it's called as forensic pathology.
okay, sir. Sir, do you see any gender-specific pros or challenges in this branch? Like, if you have worked with male or female counterparts, so you see any.
Yes. Like there are very few women in this branch, and they have to deal with suicide, homicide, murder, these kind of cases. Because sometimes it might happen that the cases may come in the night, some VIP cases, or there can be mass casualty or some pressure and something like that. So being a woman, they can intimidate you and like that. And yes, it's in the all the medical field like that only. If you are not strong enough, if you are not can take stand for yourself, then anybody can come and intimidate you. And there will be only male, like the cutters and the technicians, and they all will be male only. There very few female will be present in the department.
Yes, sir. Very true, sir. Sir, can you share some your real case or moment that changed your perspective as a doctor? Anyone? One?
And there were many cases, like there were many cases of murder, of a father
Anyone
murdering
significant
a
one, sir?
son.
Anyone you remember?
Like the about the Ambani case where the gelatin sticks were found outside the house of Ambani in a van.
Sorry, sir.
You remember bomb scare case of Ambani bomb scare case,
Yes,
gelatin
sir.
sticks were found outside his house.
Yes.
So that case came to our RGMC Thane when I was doing my first year residency. So that person was brought dead and suspected, he was suspected homicide. And that time I saw the proper NIA team, ATS team, around 15 to 20 police vehicles, around 100 police personnel were there. And that time I was so surprised and fascinated by this branch ki how such cases can change your perspective, and how much have to be how much even a minute mistake can cost you, because you have to go into the NIA court, you have to go into the ATS court, so you have to give your evidence, expert witness there. So such cases, there were police for 3 days outside our department, police and media personnel, everything coming going, it was recorded on the video and going live every day. So there are other cases like this which were chilling, like finding a body after 7 days, which were in a the box, metal box, doing exhumation, digging the body out after 2 months of a murder. So many interesting things, interesting cases, going to the crime scenes and hearing the story why someone murdered. Like there were cases where people caught a person and they thought he fell from the ground, but when we saw the body, we found the injuries on the back with the sticks and everything. So finally, the story was like that the person was a thief and he was caught by the people, and people hit him and then he died. So there are so many stories which come clear after the postmortem.
Sir, so like in the CID, the forensic team is there. So for that, MD medicine can MD forensic medicine can be joined there, sir. Uh,
No, 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 no. That is totally different. They have mixed both forensic science and forensic medicine into one single area. It is not like that.
yes, sir.
The postmortem is done somewhere, samples are collected somewhere, and they are analyzed somewhere. So there is a different divisions in forensic science lab for different types of. There is forensic biology, forensic toxicology, forensic dentistry, forensic ballistics. So there are different branches, and they are done by different experts. So for that, the samples are sent to different areas. And if you want to go into the CID and everything, then you have to clear the UPSC part. Then they will recruit you as a forensic ballistic expert, they will forensic fingerprinting expert, forensic document expert, like that. It is not like that. It is done by one person only. This is done by so many people. Autopsy will be done by other people. Sample collection will be done by other people. Then after that, the analysis will be done by another people. It is like that only. In the CID, they made it like only in one room, all things can be done, and that too so fast. Like today, they have done the autopsy, they have matched the ballistic also, and they have found the poison also, and they have given the things also in 2 or 3 days. It is not like it takes 6 months or years to complete an investigation.
Very true, sir. Sir, what do you think? What one thing you wish someone had told you before entering this field or forensic medicine in general, medical field, or
Uh, there was no one to tell anything because there are very few
what you
people in
feel you
forensic
must have
medicine.
known that time, or you wish someone told you? What thing? Anything?
Nothing. I'm okay with it. Nothing like that.
Like whatever your journey is like that. If I would have known this thing earlier, it would have been good.
No, I'm like I don't look towards the past. Ki what should I have told? What is like that? I just look, just do it, and we will see what will happen. I believe in myself. That's it. I also think that if I was not MBBS, if I opened a chai ka stall, then I would also be happy. I'm that kind of person.
Very
So I don't regret any decisions. I don't regret anything. It is just what is written will happen, and you cannot force yourself to anything. So that's it.
I don't have any more questions, sir. What final message like you would like to share with the aspiring specialist considering this branch, sir? To sum up all your final message.
My final message will be that if you don't want a hectic life, like, and you don't want a rat race, and you're from a first generation doctor, and you don't want, to work tirelessly till your 40s and 50s, then you realize and go back and look back that what I have done, I have been working since lot, but I have not enjoyed, and I have not, had my desires, passion fulfilled. So if you are not that kind of person, then you should choose forensic medicine, because apart from doing residency and earning a decent amount, you can follow your passion also. I have my juniors who are into acting, who are into music. They like that. Who are into business, they are just doing their residency, and in the free time they are following their passion. So if you are not inclined toward medicine, the medicine part of the medicine, where you have to treat the patient, then you can choose this branch definitely, and you can join a private institute and do what you want to do. Nobody will stop you from following your passion. That's it.
Sir,
That's what I want to say.
some quick rapid fire questions, sir. Just answer quickly for you. So, first question is autopsy room or courtroom? Where are you more confident?
Courtroom.
First reaction after seeing your first postmortem.
I was excited, happy.
One forensic term every MBBS student must know.
Medical negligence.
Social media post you are most proud of.
I post about I'm the first generation doctor in my family, and I'll make sure I'm the last generation doctor in my family.
A myth about forensic medicine you want to bust.
There are so many. So, like organs removal, kidney trafficking, like that.
If not a doctor, then what?
Most probably a chef.
So most probably chef.
Chef.
Okay, sir. Thank you, sir. Sir, lastly, this interview is conducted at a personal level. Like many of my juniors also ask, they like how to tackle the forensic medicine in for the professional examination and for the PG as well. So, your quick thoughts on that, or which book should they prefer?
Like you should prefer ya to Anil Agarwal or Bardale or Biswas. These are three books written student friendly and competency based. They are written, and you should first read the questions that coming in the answers, like the most important topics that every year come, and after that you start reading the chapters, and from every chapter you will find 4 to 5 questions will come, and that will be easy, very easy for you to remember. And also these new apps, and after that you should do the dams marrow. If you have subscription for that, then it will give, they will give you tricks easily to remember. But don't first go for that apps and then come to the books. First read the books, you will understand everything in broad area, and then you can concise it to write answers in the exams.
Sir, I when
And there are many other tricks to remember the IPC and DNS sections that are coming. So you cannot. There are no tricks. You just have to remember the particular section for that, and they are like divided in the constitution, in the laws. They are divided accordingly. So if you remember this, then you can easily remember कि from this to this section it is about abortion. From this to this is about consent. From this is about homicide. From this to this is about heart. So it will be easier according to that if you remember like that.
Very true, sir. Sir, I remember when I was in my second year, only one name we were told, buy Reddy, and I bought it, but actually not much of the interest. I actually delved into it. But in the third year,
I also I also read Reddy and I got grace marks. Only out of the 19 subjects of my MBBS, my grace marks were in forensic medicine only.
but then in the third year, someone told me to buy Parik, so I bought it. But actually, it was the notes only which saved it me at the last moment.
Mhm.
Thank you so much, sir. It was really great
Thank you so much.
having talking with you, knowing your insights of the forensic medicine, and I'm sure this conversation will help many medical students to find the clarity in their journey. And thank you so much, sir.
Thank you so much.
Anything you'd like to share? Otherwise, we can call it a day.
Yes, yes, end it, please.
Thank you so much, sir. So, to all our viewers, if you found this episode valuable, don't forget to like, share, and subscribe to know your calling. Your calling might just be one story away. Thank you, sir.
Thank